Hello. The very mention of the term I.C.U., the intensive care unit, sends a chill down the spine of those who hear it. And I'm speaking of those who are being admitted there, although they may not be in a condition to understand and to understand the situation for themselves. But definitely it's a matter of great concern to the relatives of those that get admitted to the intensive care unit. The intensive care unit in a hospital is an area which takes over the patient, which is not being now beyond the capacity of the general wards or the specialized wards or the regular treatment to be managed. Obviously, the patient is gone critical. His condition is critical, therefore he requires an intensive care, and there he's shifted to the I.C.U. The I.C.U. is equipped with a lot of equipment, and it monitors all the life systems of the patient all the time. I wish to discuss with you one serious aspect of the treatment which is meted out in the intensive care unit. Dental care in the intensive care unit is of utmost importance. The patient, when admitted there, needs to have a healthy mouth, because at any stage during his treatment he may have to be intubated. And intubation can also be as much as, say, a ventilator. We all know that a ventilator is a mechanical device which helps the patient to breathe properly. It helps the patient to survive because he's not able to breathe well. In the mouth, there's a wide range of saliva present in the mouth. And when a patient is critically ill, that saliva is much more infected or infested by a large number of various pathogens. And the the identity of the saliva there is totally different from that in a normal mouth. It will surprise you to know that 25% of the patients who are in the I.C.U., who would then have to go for ventilator, ultimately are in a position to develop pneumonia, which can be very fatal to the patient. Now, mind you, the patient may not have been originally admitted with a pneumonia, but during the course of his stay in the hospital, in the I.C.U., he develops pneumonia. So the question that comes to mind is, how did that happen? Well, when intubation takes place, when tubes are inserted into body systems, especially when, say, a ventilator tube is inserted through the oral cavity and into the trachea. Trachea is from where the windpipe goes down into the lung systems. Chances are that the saliva drains down the tubes. Now, if the mouth is heavily infested or infected with a large number of bacteria, chances are very bright that these bacteria can now find a passage via the saliva, which is drooling down into the system, into the lungs, and these bacteria then get entry into the lungs, leading to pneumonia. Now, the sad part is that 60% of these patients end up dead. I'm sorry to use the word, but if I'm talking to you straight, I like to talk to you straight. And this is what happens. This proves fatal. In 60% cases, it proves fatal. Now, the most interesting part is all these bacteria which are there have actually been traced to the plaque. The plaque is the mucinous material, or say the material which surrounds the teeth when they are not cleaned properly. And that's the origin of that bacteria. Therefore, you will understand that it is important to have a clean mouth even in the I.C.U. Normally, we do discuss how to keep your teeth clean and the gums clean so that you can stay out of trouble so far as your general health is concerned. But this takes a different dimension when a patient is admitted to an ICU. Normally in the ICU, the care which is taken is when the patient who's fed, his mouth is cleaned out regularly with a set of brushing regularly and say mouthwashes. Now, a lot of material can stick around in the teeth which are present there, and it's difficult for the person concerned, unless he's a dentist, to clean out that stuff. Now, mechanical brushes are what you use with your hand, but now electrical brushes are available which have been found to be far more effective because it doesn't require effort to make them move around in the mouth. Even somebody else, if an auxiliary is doing it, it can be done very well. Therefore, I think I have highlighted the importance of a clean mouth in the ICU. We are at this stage, we are at a time when there are almost 3.5 lakh, 350,000 dentists that have been trained and are now available for services in the Indian context. Therefore, I think it would be very natural to find a dentist as a part of an ICU team. I think it's going to be very natural to do that, because if this is what is the complication which arises out of a infected mouth, then a dentist could make all the difference so far as the care in the intensive care unit is concerned. I hope through this video, I have been able to highlight the importance of the dental care in the intensive care unit. Mind you, the patient may not be in a condition to conduct his own health needs, oral health needs, as he is not able to conduct a lot of his needs. He is attended to mostly where he is lying down in a supine position, and dental treatment at that point of time can be conducted by a dentist best in the ICU. Normally, a ICU bed is well equipped with a high-speed suction, and brushing a teeth, or say even conducting a scaling with an ultrasonic equipment in the mouth in the ICU in a position where the head is raised, can be conducted very efficiently with the help of a high-speed suction which pulls out all the material from the body and disposes it. The intention of this video is to highlight the importance of teeth at all levels, and more so in the intensive care unit, wherein, like I said, pneumonia is likely to develop in a patient who wasn't really admitted with a pneumonia to start with. I leave you there to think about this. Please comment in the section below, and before I depart, I'd like to add that these statistics which I provided are not my own. I have not generated them. They are available on the scientific forum, and there have research been conducted on these issues, and they are available out of that. So with that, I hope to bring in more videos to enlighten our dear public in the area of dental health and dental care. And at this point, I'd like to say goodbye to you. Thank you very much for listening.